Let's start by understanding what a cerebellar infarct is. A cerebellar infarct is a specific type of acute ischemic stroke that occurs when blood flow is blocked in one of the three main arteries supplying the cerebellum. These arteries are the superior, anterior inferior, and posterior inferior cerebellar arteries. Although strokes in the posterior circulation make up about 20% of all ischemic strokes, cerebellar infarcts are much less common, representing only about 3% of all cases in the United States. Despite their rarity, they can be very serious due to their location and the potential for complications. You might wonder why cerebellar infarcts are so important to recognize. The answer lies in their potential for significant morbidity and mortality. Because the cerebellum is located in the posterior fossa, swelling from an infarct can quickly become life-threatening. The symptoms can be subtle at first, which means they are sometimes missed or mistaken for less serious conditions. This makes early recognition and intervention absolutely critical for patient outcome. Cerebellum receives its blood supply from three main arteries: the superior cerebellar artery, the anterior inferior cerebellar artery, and the posterior inferior cerebellar artery. These arteries branch off from the vertebrobasilar system, which is part of the posterior circulation in the brain. When one of these arteries becomes blocked, it can lead to cerebellar infarct, disrupting the cerebellum's crucial role in balance and coordination. Cerebellar infarcts are relatively rare, making up only about 3% of all ischemic strokes in the United States. In contrast, posterior circulation strokes as a whole account for roughly 20% of all ischemic strokes. This low incidence can sometimes lead to delayed diagnosis, as clinicians may not immediately suspect a cerebellar infarct when a patient presents with certain symptoms. Diagnosing a cerebellar infarct can be tricky. The initial symptoms are often subtle and can mimic other, less serious conditions. For example, patients may experience dizziness, nausea, or mild headache, symptoms that are common in many benign illnesses. This subtlety means that healthcare professionals need to be especially vigilant and consider cerebellar infarct in their differential diagnosis when these symptoms are present, especially if risk factors for stroke exist. Recognizing the early symptoms of cerebellar infarct is crucial. These can include vertigo, impaired balance, severe headache, altered mental status, vomiting, and drowsiness. Because these symptoms can overlap with other conditions, it's important for healthcare providers to keep cerebellar infarct in mind, especially if the patient has risk factors for stroke or if symptoms are severe and sudden in onset. One of the hallmark symptoms of a cerebellar infarct is vertigo, a sensation of spinning or dizziness. This is often accompanied by difficulty maintaining balance. Patients may feel unsteady on their feet or even be unable to walk without assistance. These symptoms can be mistaken for inner ear problems, so it's important to consider a cerebellar cause, especially if other neurological signs are present. Another important symptom to watch for is a sudden, severe headache, often described as the worst headache of the patient's life. This can be accompanied by nausea and vomiting. These symptoms, especially when they appear together with balance problems or altered consciousness, should raise suspicion for a cerebellar infarct and prompt urgent evaluation. Cerebellar infarcts can also cause changes in mental status, such as confusion, drowsiness, or even decreased responsiveness. These symptoms may develop as the infarct progresses or if swelling increases in the posterior fossa. Because these changes can be subtle at first, careful monitoring is essential for anyone suspected of having a cerebellar infarct. One of the most dangerous complications of cerebellar infarct is swelling, or edema, in the posterior fossa. This can compress vital brain structures and lead to rapid deterioration. Healthcare professionals must screen patients with suspected cerebellar infarct for signs of progressive edema, such as worsening headache, decreased consciousness, or new neurological deficits. Diagnosing a cerebellar infarct typically involves a combination of clinical assessment and imaging studies. CT scans and MRIs are essential tools for visualizing the infarct and assessing for complications like edema or hemorrhage. Early and accurate diagnosis is key to initiating appropriate treatment and improving patient outcomes. Once a cerebellar infarct is diagnosed, treatment focuses on stabilizing the patient, preventing further damage, and managing complications. This may include medications to dissolve clots, control blood pressure, and reduce swelling. In severe cases, surgery may be necessary to relieve pressure in the posterior fossa. An interprofessional team approach is often needed for optimal care. Managing cerebellar infarcts requires collaboration among various healthcare professionals, including neurologists, radiologists, nurses, and rehabilitation specialists. Working together ensures that all aspects of the patient's care are addressed, from acute management to long-term recovery and rehabilitation. The ultimate goal in managing cerebellar infarcts is to optimize patient outcomes. This means not only addressing the acute event but also planning for rehabilitation and preventing future strokes. Patient education, risk factor modification, and regular follow-up are all important components of comprehensive care. Summary: cerebellar infarcts are a rare but serious type of stroke that require prompt recognition and management. Their subtle symptoms and potential for rapid deterioration make them a diagnostic and therapeutic challenge. By understanding the key features, risk factors, and management strategies, healthcare professionals can improve outcomes for patients with this condition. Staying vigilant and working as a team are essential for success.